Hey guys, Dr. Brown here with a topic to talk about today for the men. We're going to talk about gynecomastia, or male enlargement of the breast. This is a lot more common than you could think. I see a lot of young men with this problem. We do these operations and they're life-changing. Sometimes men have lived with this for their whole life, either not knowing what it is or that they could do something for it, or just not being able to do it. So gynecomastia, what is it? Gynecomastia is male enlargement of the breast. Now, it's different from being overweight and having fatty tissue in the breast. The breasts for men and women are both made up of glandular type tissue and fatty type tissue. We start out at a younger age with more glandular tissue, and as we age, we get more fatty tissue. That's why when women get mammograms at a young age, the glandular tissue looks whited out on an x-ray, versus when they're older with more fatty tissue is transparent, so you can then see calcifications and tumors easier. So that's why when we talk about glandular versus fatty tissue, that makes a big deal. So getting back to the men, what are some of the reasons and the causes for gynecomastia? Well, sometimes it's just hormone imbalance, meaning when you have a higher estrogen imbalance in your body, that can stimulate the gynecomastia tissue. We often see that in newborns who've had a lot of transmission of estrogen from the mom across the placenta to their bodies, where they get stimulated gynecomastia tissue. And it's basically thick, hard tissue behind the nipple areolar complex. We also see it in old men who've aged, where they have a big testosterone imbalance between that and estrogen and progesterone. So hormone imbalances are a big one, which ties into being overweight. If you're overweight and you carry a lot of extra fatty tissue, when you're overweight, you have a higher turnover of estrogen, and that can also stimulate that tissue. Another thing that can cause it would be medication. So people who take steroids get it, or there are certain known medications that can cause gynecomastia. One of the other things that can cause it is heavy marijuana use. Heavy marijuana use actually causes a hormone imbalance, which can stimulate the breast to be tender and firm and make that gynecomastia more prominent. Probably the least common one that we see would be a testicular tumor or some other kind of tumor that emits hormones that stimulate it. Now, when you come to the office, we're going to talk about all these things and try to tease through which it is for you. And oftentimes we'll send you to your primary care physician to get a battery of lab tests looking at hormones. Obviously a physical exam. Do you have a testicular mass? Do you have a history of testicular cancer? Those can be things that can contribute to gynecomastia, or male enlargement of the breast. So those are many of the things of the why. Why does it happen and how can it happen? And for a lot of people, it's just congenital. So you may have gained a lot of weight, stimulated the gynecomastia tissue that's firm and hard, and as you lost weight, that tissue stayed firm and tender. And it can be very painful. And it also, I've seen men in my practice who are extremely fit, I mean ripped like fit, which have little boobs on their chest because it's the gynecomastia tissue. There's a couple ways to take care of it. When we talk about gynecomastia, we can grade it into grade 1, 2, and 3. 3 being more severe, 1 being less severe. As you move up the tier of grading, you're basically talking about having too much extra skin versus not really having extra skin. And the reason that's important is sometimes we literally have to do a breast reduction, almost like we do in females, where we have to make the bigger incisions, take out extra skin plus the gynecomastia tissue, relocate the nipple areolar complex into its new position, and close up the breast. Those would be the more extreme cases. The most common way that I take care of gynecomastia not in my office, but in the operating room, is a combination of liposuction of the chest with direct excision of the gynecomastia tissue. So that glandular tissue that I talked about, think of it this way. When I go to the operating room, most of these guys are carrying some fatty tissue on their chest, so I'll globally liposuction down the whole chest to make it flat. When that's done, we do what's called the pinch test, where we can actually pinch the nipple areolar complex while you're asleep, and we can feel the hard, firm collagen matrix that's left behind when you suction all the fat out of it, and that is the gynecomastia tissue. In some men, it could be a small nugget, in some men, it's a big area. I can feel that preoperatively and mark that. So what I'll usually do is liposuction the chest down first, and then I'll make a small incision around the nipple areolar complex to try and hide that scar in the pigmented portion of the areola, and we actually go in and we excise that piece of tissue. So those two things alone are usually curative. So the next question that some people might ask is, will it ever come back? Well, if you don't get all of the gynecomastia tissue, certainly that can be re-stimulated and you might have to go back for a re-excision. It's usually uncommon for that to happen, but it can happen. The other thing that men will ask me is, what's the recovery like? What are the restrictions like? So a couple things I have to do after this operation. Usually I'm taking out a large enough segment of tissue that I have to leave a surgical drain behind. No one likes surgical drains, but it has a purpose. And the purpose of that surgical drain is to drain any liquid that might collect into the area where I've removed that chunk of tissue. And so the skin's gonna contract back down to the chest, but if we allow it to fill with fluid, the skin will never contract back down on top of the normal pectoralis muscle and some of the other fatty tissue we left behind. So usually I'll place that drain through the same incision that I've made to do the liposuction through, so I don't make an additional incision. You'll have that drain for about 1 week, and it generally comes out in the office for 1 week. The recovery from something like this is you're generally pretty tender in the chest for 1 to 2 weeks. We have you wearing compression garments to help compress the skin against the chest for contouring. The early recovery is about 4 to 6 weeks. Now, I don't generally let you do a lot of strenuous exercise for the first month. If I've had to do a reduction type of a situation where I've made bigger incisions, for 6 weeks I don't want you doing any strenuous heavy lifting because you can bust those incisions open. If we've just made a small incision around the areola, I might let you get back to cardio type work and even some other weight lifting around the body that won't stress that incision early on, but lightweight. So the early recovery is 6 weeks. The extended recovery period I like to discuss are the months ensuing after surgery, right? You have to think of scars on the outside of the body the same way you think of scars inside the body. The scars on the outside of the body, we tell people it takes a full year for those scars to soften, mature, to turn into better colors from being red to being faded. Well, the internal operative field is one big scar. So for the first 2 to 3 months, things are lumpy and bumpy, they're hard, they're firm, there's lymphatic swelling. So we might have you doing scar massage and things to improve lymphatic drainage to improve the tissue quality. So you might not get that final result for 2 to 3 months or even longer. You might have areas that are tender that last for a year that aren't tender on one side. So I'm sore over here, but I don't feel it over here. That's just kind of the name of the game with surgery. It's not something I did wrong. It's just the operative field heals differently and things scar and heal differently. So once you've recovered from that, I can tell you that when men come back to the office after having had that procedure, the first thing they always say to me is, why did I wait so long? Now, for some people, it's a money issue because it is a cosmetic procedure. This falls into one of those categories where insurance isn't gonna cover it. Unfortunately, they don't see it as medically necessary, and that's just the game that we play in this field of plastic surgery. But most men that come back are extremely happy and couldn't feel any better in their body. Like guys who wouldn't take their shirt off in the gym that are pretty fit are now walking around the house without their shirts on. So it's a wonderful procedure, and if you think that this is one for you or something that you have, feel free to contact me anytime and ask me questions. I would love to see you in my office. It's an amazing procedure and it brings a lot of happiness and joy to a lot of people's lives, and I love doing it. So thank you for listening today. I hope that brought some education into your life. Have a great day.